If we sort of tick off the box on scleral lenses, yes, look, that's something that is sometimes potentially used in someone who's got quite severe dry eye to try and protect the cornea, and you're holding a body of liquid against that. Scleral lenses we might use occasionally in someone who's in a really dusty environment, or wants something that's sort of really super stable. We've got to be a little careful with oxygen with scleral lenses. If you're talking, the average person with short-sightedness and maybe a little bit of astigmatism and small amounts of long-sightedness now as well, we can do Ortho-K, which is the overnight lens. I think we've discussed before. It's one of those lenses that sounds a bit too good to be true, even though it's real. The concept has been around for probably 60 years now, and it's probably been 30 years in actually being used in the modern form. But effectively, that is a rigid lens that you put on before you go to sleep, and it gently reshapes your cornea. And it's a temporary thing. It's a bit like how clothes and jewelry can leave a little indent on your skin. Cornea is and so we use a specially made back surface on a contact lens to leave an imprint. And as I said earlier, the cornea is a great big lens, so it only need to change the shape of it a little bit to be able to correct your vision in many cases. So yes, and the advantage then is that you've put the lens in, reshapes your eye, you wake up, you take the lens out, you can see clearly. You don't have a lens on, so any of those contact lens related irritations and dry eye are minimized in that format.
I'm in some in a Facebook group for scleral lens wearers. Not that I wear sclerals, but I'm interested to hear what people's experience is with them. And what I hear from some people is their eyes, they might be dealing with eyes that have undergone some sort of trauma, or maybe like in the old days, they had some kind of invasive procedure that didn't go so well. So a lot of those type of people still have very sensitive eyes. So do you think sclerals would be a good option then for that type of patient as well?
The biggest use of scleral lenses is someone's got a highly irregular cornea that you just can't sort of get comfortable or clear vision any other way, because you're providing this nice big sort of consistent surface for the light to hit first, because you've covered up the irregular cornea. So we do a fair bit of fitting of scleral lenses in this practice. You've got keratoconus, you've got post-graft patients, you've got certainly injury. We don't tend to see as many of them now, but in the early days of some laser surgery, some people used to get an ectasia after the laser surgery. But I think they've learnt to rule out those higher risk cases. So I've seen one recently, but that's typically less often, at least in my part of the world. And like I said, I've fitted a few people who have had significant dry eye, where it's almost like a bandage. It helps protect the eye from dryness.